Hey guys, so let's quickly take a look at the knee joint anatomy. Now, there are four types of bone that makes up the knee joints. Now, those bones are femur. So let's label that. This is the femur. We have the patella, also called the kneecap. Okay. Then we have this called the tibia, and this right here called the fibula. These are the four basic bones that make up the knee joint. Now, most times the fibula is not oftentimes mentioned because it doesn't directly articulate to the joint. It just articulates to the tibia. Now, after looking at the bones, we're going to look at cartilage and ligaments that make up the knee joint. And the first I'm going to talk about is the articular cartilage. The articular cartilage. Now, every bone has an articular cartilage. Now, the articular cartilage just cushions the effects of the bone sliding against each other. So, we have the articular cartilage here and here. Okay, so this is the articular cartilage. Articular cartilage. Now, the next thing we are going to look at is what you call the meniscus. Now, the meniscus sits right here. Then we have another here. Now, this meniscus is called the lateral meniscus. Lateral, that means it sits at the side, outside the body. Then we have the medial, which is between the legs. Okay, so the medial meniscus. Now, this meniscus forms something like a groove that helps the femur. So the femur sits on the groove, on this groove. Now, the meniscus is very important because it actually serves as a cushion, right, preventing the femur from sliding off the tibia. So it's very important. So when weight is placed on the tibia, what happens is that the meniscus actually has a large surface area. So it expands as the pressure is placed on it, it expands to make sure that it balances the femur. Okay, so that's the function of the meniscus. Now, another thing I will talk about is what we call the cruciate ligament. And there are two types of the cruciate ligament. We have the anterior cruciate ligament. So this is called the anterior cruciate ligament. And the cruciate ligaments, they are found at the posterior of the knee. So the back part of the knee is where you can find them. Now this is called the anterior cruciate ligament. Let's label that. Anterior cruciate ligament. Now, the function of the anterior cruciate ligament is that it prevents the tibia from sliding forward. So it holds the tibia in place. Okay, so it prevents the tibia from sliding forward. Now, the next we're going to look at is the posterior cruciate ligament. Now, like the name implies, posterior, it is found behind. It is found behind. So we have the posterior cruciate ligament here. Now, if you observe, these two ligaments form something like a cross, like this. So this is how it is behind your knee. It is very important. Now, the posterior, this is the posterior cruciate ligament. Now the posterior helps, or it enables the tibia to be held strongly to the femur. So it prevents the backward movement of the tibia, while the anterior prevents the forward movement. The posterior prevents the backward movement. So this cruciate ligament helps to hold the joint in place. Now there is another type of ligament I would mention here, and that is called the lateral collateral ligament and the medial collateral ligament. Okay, so because of um, space, I'll draw the lateral collateral ligament here. So we have a ligament here. So this is the lateral collateral ligament. Okay, then we have also at this end, and that is called the the medial collateral ligament. Now, what is the function of the collateral ligament? Now, they prevent the joint from sliding sideways. So it holds this part of the joint from bending this way and this other part from bending this other way. So it prevents side sliding like this. Okay. Meanwhile, the cruciate ligament prevents it from going backward and forward, which is the anterior and posterior cruciate ligament. Okay. The medial meniscus and the lateral meniscus serves as a groove where the femur sits. Okay, and this is just an overview of the knee joint anatomy. Okay, so thank you and see you in my next video.